Because it seems that anecdote you were talking about in terms of the patients feeling seen, it's almost like if you envision the experience as like a leaking boat, right? It's almost like the program's plugging the leak. You're giving attention and care where otherwise it would completely be absent. They'd be just lost wandering in the dark, right?
I think that's a beautiful metaphor for how postpartum is for many people. And I think that we've really exposed a lot of kind of unmet need with this patient population. And that's why selfishly, I feel like everyone should be part of it because I think we are able to provide essentially on-demand support when people need it most. And right now, obviously, we focus on hypertension or people with hypertension, but we have found that a significant proportion of the people with hypertension in our program also have mental health symptoms that we've been able to not only identify, which the majority of which would have been unrecognized, but also get them the mental health support that they need through timely referrals, which again, the people in the program are extremely grateful for.
And you're doing social needs screening too, right?
Yes. So thank you for reminding me of that. So everyone who's part of our program, as soon as they enroll, they do a comprehensive social needs screen. And if any unmet needs are identified, they are consulted, they receive a social work consult. And again, like this is not something we do routinely in the obstetric hospital. So we are finding a relatively high proportion of our patients have unmet needs like food insecurity or housing insecurity that we're able to help them navigate starting in the hospital and then after discharge. And then the other thing we do while they enroll is they all undergo comprehensive mental health screenings for symptoms of anxiety, depression, trauma, stress, and suicidality. And like I said before, all of that does not happen otherwise in a birthing hospital. And we have found a really high proportion of patients have significant mental health symptoms that requires treatment. And so we feel like the program was founded in the need of hypertension, but it really has become a program that is more comprehensive. It's far beyond the scope of merely blood pressure is what we're doing.
Yeah, you were talking about the collaborative care model, and that is a core tenet of patient-centered medical home, which
Yes.
is a primary care concept. But it's almost like you've made patient-centered medical home for OB and
Yes.
postpartum care.
Yes. So we in obstetrics, we're really good at making our patients feel like their prenatal care, like we're the center of their medical care during pregnancy. But then we fail after delivery to continue that. And that's where it really steps in.